we have Mark back, so we can speak a little bit more about that.
It just continues. uh, no, it's interesting because I was listening as I was trying to get back on, and you're right. It was really, I was at a conference that was talking more about nutrition than anything else, and about the gut and how we know the connection between the brain and the gut is so set, it's there, and how they found that these compounds migrate from the gut, or they start forming in the gut and migrate up the vagus nerve to the brain.
Facebook's doing some stuff today. It's not liking us. I'm gonna try to bring them back on. So the gut. There we go again.
Whatever. If I have to keep doing this, I got to keep doing this. It's worth it. Anyways, my point was kind of that I post that because it had really blew my mind that they would even consider it, because there's more to the vagus nerve than just transport of one compound. You know what I mean? It controls so much in the body. And you post, and I said, can we talk about this? Because I know this is like one of your passions, is the vagus nerve. And it's amazing because the timing, I guess, was really good, because you're literally, your book launches today, right? Today is the day it launches.
Absolutely.
Who better to talk to about this than you? And to kind of get into it. And I think there's a lot of people who don't really understand what the vagus nerve is and what it's important for. Did you want to go over that real quick?
Yeah, so I'm going to get into kind of a little bit about the vagus nerve. So the vagus nerve starts in the brainstem, just behind the ears here in the center of the brain, and or in the center of the body. And what it does is we have two vagus nerves. We have one on each side that come off of the brainstem. It is the 10th cranial nerve. We have 12 cranial nerves. These are the nerves that have effects in and around the face, the mouth, that area, this entire kind of cranium area. But there's only one nerve that exits the cranial cavity, and that's the vagus nerve. And it's called vagus because the word vagus comes from the root word vague, or wandering, which essentially means that it goes everywhere, because the vagus nerve has innervation and has specific signals being sent to the heart, the lungs, the stomach, gallbladder, pancreas, liver, small intestine, large intestine, kidneys, spleen, and the thymus as well, until the thymus involutes in our teen years. But essentially, we have this tool that's actually sending signals up and down from the brain, literally from the brain, to the rest of the body. And this is really important in the gut-brain connection, connecting from the gut to the brain. And so you were at this conference and you were learning about or speaking about this important factor that we need to be able to connect and have a conversation between our first brain and our second brain, which is our gut, or in reality, our first brain, which is our gut, and our second brain, which is actually just our brain.
Yeah, and it's interesting because I don't think people realize how widespread or how much that nerve affects, because most people, when they're exposed to a problem with a nerve, usually it's something like a disc problem, they get pain shooting down a certain area, or a hand goes numb, or fingers, or something like that, where you can localize it to one area and someone can actually kind of specifically see or figure out where the problem's coming from. And that's not necessarily true with the vagus nerve. So poor function of a spinal nerve, you can kind of figure out what's going on. Now, when it comes to like poor function of the vagus nerve, is there a way to know, like a way to check or see what's going on?
Definitely. So there's a few really important tests that can actually give us an indication of how well the vagus nerve is truly functioning. So the vagus nerve has four functions. The first function, which we talk about, is the parasympathetic function. And that function is actually to help get us into a rest and digest state. It allows our heart rate to come down. It allows our breath rate to come down. And it allows us to get into a digestive state. So it sends signals to the stomach, gallbladder, liver, pancreas, small intestine, and large intestine to actually produce a digestive process. This is where we produce digestive enzymes. This is where we produce stomach acid. It allows us to do that job. And so the parasympathetic activity that's going there is going to tell them, we're in a calm state, we're relaxed, this is a great time to activate and actually digest food, okay, and gets us into that calmer state. The second function is afferent function, actually sending information from the gut, from the heart, from the lungs and everything up to the brain. And this is a really important factor because if we have any digestive dysfunction, if we have any issues with constipation, diarrhea, slow bowel movement, slow bowel transit time, the time that it takes from when you eat food to when it's coming out the other end, that is a huge sign of vagus nerve dysfunction. If it's not working optimally, between 12 and 20 hours is kind of the optimal. That would be a direct sign that the vagus nerve is not functioning well. And that tells us both through parasympathetic activity and through afferent function. And the afferent function is that direct communication link between the gut bacteria, our microbiome, and our brain directly.
Now, are there other, because it sounds like obviously digestive issues are a sign that there's a problem with the vagus nerve. Are there other things that you'll see, other certain symptoms or signs that you know that your vagus nerve is just not firing? Or are there certain conditions that people might present with?
Yeah, so one of the more common ones that we see through functional medicine, even in chiropractic offices across the world, one of the most common ones that we see is when people have gallbladder dysfunction, when they have gallstones, when they have issues with absorbing fat. If people have had their gallbladder removed, that's a sign that the vagus nerve was not sending a strong enough signal to the gallbladder to pump out bile. So bile is produced by the liver. It moves into the gallbladder, and yes, we do need our gallbladders. If we can have it, it's probably best not to have it removed. But when the bile goes and sits in the gallbladder, it's like sitting in a plastic sack, like a bag almost. But that sac gets a signal from the vagus nerve when we eat a fatty bite of food, something that like an avocado, for example, or coconut. When we have excess fat coming in, we send a signal up to our brain saying fat is coming, we need bile in order to be able to bring that fat into a body from the small intestine. And so as the fat makes its way down through the stomach, it's broken down, then we have this signal that's sent to the gallbladder to pump out the bile into the body, into the small intestine, and pull the fat into the body for us to be able to use. Now, if we're not getting that strong signal to the vagus or to the gallbladder, it's not going to be able to pump, and so the bile that remains in the gallbladder can crystallize and start forming stones. And when those stones get stuck in the little pipes between the liver and the gallbladder and the small intestine, it starts to cause pain. And this is where people get gallbladder removal surgery, because it's easier to just remove that than to rebuild the tract of the vagus nerve function to the gallbladder.
That's really kind of cool, and I'm sure there's other issues too. I mean, considering the vagus nerve affects things like heart rate and respiration and stuff like that, I'm assuming that there's other things that might crop up as well as far as symptoms go.
Yeah, so what we tend to see is if anybody has a heart rate, so if you have your cell phone and you can check your heart rate through like Samsung Health or Apple Health, checking your heart rate is a really great factor in being able to know what is actually going on with your body. So if your heart rate is really high, so anything over like 75, 80, at that point, if we really start to get higher with that heart rate, what we're looking at is that you don't have strong parasympathetic activity, strong vagus nerve function. We should see an average heart rate sitting between kind of the 50 to 70 zone is the best rate, but the lower the better. And so if your heart rate is higher, that's a sign that it's not doing well.
Yeah, that's interesting. Now, obviously there's signs and symptoms. Are there actual tests that you can do to see how well it's working?
So for bowel transit time, I talk about this in the book as well. For bowel transit time, this sesame seed bowel transit time test is a great way to do this. So I have patients take a spoonful of white sesame seeds and pour that into a glass of water, and then drink that glass of water without chewing any of the seeds. And when you do that, what's going to happen is those seeds are going to start to pass through your digestive tract, through your esophagus, to your stomach, small intestine, large intestine. And I want you to record down the time that you drink that solution or that water with the sesame seeds in it, because you're going to count how much time it takes from that point onwards up until the seeds start to appear in your stools. And that time is a great way to tell how fast food is moving through the digestive tract. So that's one really easy tool. And so that should be anywhere between 12 and 20, maybe 24 hours at max.
Yeah, that's
And
actually
then
pretty
another
slick
one,
because honestly, if there's people out there that are like, oh, I go 2 or 3 times a day, that's no problem. But that doesn't necessarily mean that things are moving through the tract
exactly,
as well as they should be.
exactly, because we have a reflex built in. Our reflex is when we eat, we start to have peristalsis occurring and start to have movement occurring. But if there's things backed up or if there's almost like a sludge or a biofilm that's stopping things from moving, then we're going to have issues with actual transit time. So this is a great test to be able to see if that is working well.
Now, I know this question will probably come up with people, but with sesame seeds and stuff like that, people probably ask you if they have diverticulosis or really bad irritable bowel issues or something like that. Is that still okay for them to do that?
They tend to be okay because our bodies aren't designed to digest sesame seeds that have the covering. So you should be okay. Some people may have sesame allergies or intolerance to that, so it's probably best not to use that. You can use other tools as well in that scenario.
No, cool, cool. You were gonna say something else too, and I think I interrupted you right before
No problem.
you got to it.
I was going to talk a little bit about heart rate and heart rate variability. So testing that. So testing your heart rate is a really easy thing to do. You can do it on your phone, you can do it at your doctor's office, doesn't matter. But heart rate variability is actually a direct sign of how well your vagus nerve is functioning. And so I use an Aura ring. This is my Aura ring, which tracks my heart rate variability at nighttime, especially. And that actually tells me how my recovery is occurring, how well my body is recovering over that nighttime period.
Yeah, that's
The
awesome
higher your
too.
heart rate variability, the better your vagus nerve is functioning. And as you see overnight, if you see that your heart rate variability is going up, that's a direct sign that you are recovering well and that your body is not under too much stress. So it's a really good sign of vagus nerve
And that one
function.
always interested me because that always seemed counterintuitive that a higher variability meant it was better. Like I always
Yeah,
felt like, smooth
you
and
would
steady
think you
would be
would
good.
want kind of beat to beat to beat to be the same, but what's really different is the higher the variability, the more resilience your body has.
Ah,
So it's able to handle changes in stressors and bring you back to a steady state. So high variability, low heart rate.
nice. That's really cool. Now,
Yeah,
if someone has seen these symptoms or signs or they've checked themselves out and they've checked their transit time and they think that their vagus nerve is all screwed up, what is there anything or is there any way that they can start to sort of improve that? Like, do you have top tips?
definitely. So in the book, I go through probably about 23, 24 different exercises and practices that people can do. But I'll give you guys my top three. These are the three easiest ones to add into your routine that are really simple and will have great effect on how your vagus nerve is functioning. So first one is gargling. Gargling is a huge, huge positive. Thanks, Kishan. Um, Gargling is awesome because remember I talked about how vagus nerve has four functions. I talked about the first two. The third one is motor function to the laryngeal muscles and the pharynx muscles. And so the muscles at the back of the throat and the muscles of the vocal cords are actually innervated by vagus nerve as well. And so gargling will actually activate that nerve or those muscles that are innervating, that are innervated by vagus specifically to allow that gargling to occur. So if we take a sip of warm water, and I get my patients to keep a cup beside their sink for every time they brush, they're going to gargle as well. So once in the morning, once in the evening. And you can do this 3 times in the morning, 3 times in the evening. It takes all of a minute, maybe two. And just take some warm water, put a little bit of salt in it as well, because salt can be very helpful and antibacterial purposes and helping to break up some of the biofilm that gets to the back of the throat. And you're going to take that sip and you're going to gargle really, really well. Gargle so hard that you actually start to tear from your eyes. Because if you're not tearing from your eyes, you're not actually activating the nuclei that are necessary to spread that message, to get it out there. And so gargling is a really, really important tool for helping to improve vagus nerve function. And if you do this consistently, you're going to notice major, major changes. Okay.
Yeah, that's amazing. That's a hard gargle.
Yeah, yeah, to the point where you're tearing is the sign that you're doing it right. So that's big. All right. Second exercise or second practice is going to be learning to breathe correctly, making sure that you're taking breaths using your diaphragm. Because when your diaphragm moves up and down, it's actually allowing your lungs to expand to a maximal amount. But at the same time, we have to remember that it's not just pumping the lungs. The diaphragm going up and down has a direct motion effect on all of the digestive organs, all of the organs like the stomach, small intestine, large intestine, liver, kidneys. It's actually pumping those up and down as well. And that motion is really important. A lot of us have forgotten how to breathe correctly. It's the same reason why we have such tight traps and rhomboids and shoulder muscles, is because we're activating these muscles using these on a regular basis to breathe. And so if we learn to breathe using our diaphragm correctly, that's going to make a big difference. So the real way to check to see how you're doing is put one hand on your chest and one hand on your belly. And I want you to just take a deep breath, step back a little bit from your chair, leave a little bit of space, and take a deep breath and see which hand moves. And what we should notice is the top hand does not move, and the bottom hand should come in and out with the diaphragm pumping the gut to allow that motion to occur. So that's a really important factor in getting this working really well. And then if we want to add extra weight to this, and this will be the third exercise, is adding cold showers. It's like adding a weight to doing a bicep curl, for example. So what happens when you jump into a cold pool or you jump into a cold lake? The first thing that happens is your body kind of shrivels up and you start to breathe really, really shallow because your body's under stress, a physical temperature-based stress. And what happens is we put ourselves into a sympathetic state. And now what we can do is we can train ourselves to breathe deeply while in that situation. So I get my patients to do this every day where they start to take showers at their normal temperature, but for the last 1 minute of their shower, I want them to turn the water down to as cold as possible and let it hit on the back of their neck. All right. And not everybody loves doing this. Obviously, it's a tough one to do, but what you're going to do is you're going to cause your body to go into a stressful state. And then you're going to practice breathing diaphragmatically and deeply while that cold shower is hitting on the back of your neck. This is a really simple, easy, free tool. All three of these are really easy to do. And they're going to be a sign of how well your body is functioning, but how well your body can potentially function as well when given the right exercises.
Now, I'm assuming especially with the cold water, you could start shorter and kind of expand your time. It's
Yeah,
not like, all right,
exactly.
get
So
in there for a minute.
the
And
last minute. Yeah, so
yeah,
start with the
thank
last
goodness.
minute of it, and then if you want, if you feel comfortable, and I talk about it in the book, go 30 seconds longer every few days, and make it a little bit longer so that your body gets used to the idea, and then eventually you can get to the point where your showers are entirely cold, and you're actually training your vagus nerve while you're in the shower. And cold showers have been shown to be amazing for anti-inflammatory purposes. They activate the vagus nerve really well, which activates the cholinergic anti-inflammatory system. Really important factor in getting our bodies to reduce inflammation, essentially putting the brakes on the immune system function. So these are really, really great tools for making sure that anybody who's dealing with a chronic autoimmune condition, anybody who's dealing with gut function issues, or even people that just want to optimize their health and really get their vagus nerve functioning really well, can do so by just adding in these little exercises.
Yeah, that sounds amazing and really simple too. And it's I'm sure a lot of people have watched or will be watching and listen to this and go, oh crap, how I should do this and where could I learn more? I'm sure there's a lot more in your book as
Tons.
well. Um, are there specific people that are going to go through this and that should definitely look at getting the book and are going to be able to find a lot more benefit out of it?
Yeah, I've written this book with a couple of intentions. The first is to actually teach healthcare practitioners what we're missing. A lot of people are missing the fact that the vagus nerve is underactive in so many chronic health conditions, autoimmune diseases, gut dysfunction, brain fog, anxiety, depression, all of these conditions, all of these people that are dealing with these conditions tend to have really poor recovery capability, really poor vagus nerve function. And so healthcare practitioners can use the tools in here to help improve the health of their patients. But I also wanted this to be a way for patients to really take charge of their own health, to really be able to be their own doctor. to be able to be their own caregiver and take back that responsibility for their health. And so it's written very in a very easy to follow way. Even Dr. Tom O'Brien was gracious enough to write a recommendation about the book, saying that it's written in such easy language to ensure that anybody and everybody can use these tools to really feel better, learn a lot, and be able to understand some complex ideas in very simple terms.
Which I think is great, honestly, because what it actually sounds like is a lot of the information in the book, if people take it and understand it and start to utilize it, then there's a lot of potential there for people to be able to remove that reliance on synthetic or even natural things to try to essentially calm themselves down. So you're not always necessarily going to have to take an antidepressant if you can actually learn or retrain your body to do what it's supposed to do, or pop St. John's wort every day because it kind of calms you down. It's actually your body's natural ability to do that, rather than trying to support it on the outside for the rest of your life. You can actually get yourself to be able to adapt naturally versus trying to always force something in from the outside, which I think is amazing. And first of all, I appreciate you kind of coming on here and setting this up in a sense, because it was kind of a long track just to get to this point, and posting this on your own Facebook page. I'll make sure I post this over on mine and on my office page too. But I want to make sure that they have access to the book too. I'm going to put a link to it when I post it. Do you have, I have a link, but is there a place that people can go to learn more about the book, or should I just use the link? What's the best way for them to
So
do
the
that?
easiest place, if you want to learn a little bit more about what I'm talking about in the book, what's covered, and some really interesting kind of testimonials and tools from a lot of people, go to vagusnervebook.com. Make sure you spell it correctly. It's VAGUS, vagusnervebook.com. It's not Las Vegas, very different. All right, go to vagusnervebook.com. You can learn all about it, and then there's links to order the book on Amazon, Barnes and Noble, Chapters, Indigo, like you name it, on IndieBound. Feel free, order it from anywhere. It's going to be available in bookstores. It's available online. It's, in my opinion, a really simple read, and I've gotten some great testimonials from a lot of really great docs and patients as well, that they've learned a lot and it was really easy to follow.
Yeah, that's an amazing thing. And like I said, I appreciate you coming on and talking to me, or I guess in this case, me talking to you. I want to make sure I get the word of this book out to a lot of people, because I think there's a lot of people that are going to benefit from it. And also, congratulations, because this is your first book, right? You're officially a published author now. So I think that's awesome. And I appreciate the ability to actually talk to the person that wrote the book on the subject. You know what I mean?
Definitely. It's weird to see your name on a book, but at the same time, it was a lot of work, and it feels really, really good to have a day like today, where I'm excited to share this with everybody now. All of my hard work is now coming to play. I just want to answer one question here. Shaniza asked if there is an audiobook as yet. We're working on it. It's not quite ready, but as soon as it is, I will let everybody know.
Yeah, that's awesome. Well, good. Again, I appreciate your time, Navaz. I appreciate you taking pretty much, it sounds like, the whole day to talk to people about the book, and I want to make sure the word gets spread about this. So I'll get this going and get people excited about your book here.
Amazing. Thank you so much, Mark. This was a pleasure. And yeah, let's spread the word. Let's get people healthier. Let's make the world a healthier, happier place.
Yeah, same here, man. I appreciate it. Go enjoy the rest of your day, and we'll be talking soon.
Sounds great.
All right, thanks a lot.
Bye.